Giraffes drop their baby 6 feet from the sky after they're born. Should we as humans do the same, since apparently we are not giraffes? Hi, I'm an actual OB/GYN who actually practices human obstetrics and actually delivers human babies. So I'm going to talk about why everything that the chiropractor says here is not medically accurate. Now, both from the veterinary side and the human medicine side, this is factually incorrect. There are some animals who have scheduled cesareans. And on the human medicine side, we do have standards of care about when it comes to recommending a cesarean for too large of babies, and that is because we're trying to avoid the devastating side effects of a shoulder dystocia, which exponentially increase over a certain estimated fetal weight. Now, this makes no medical sense because we as humans don't put our patients on bed rest when their labor is taking too long. And in fact, we really don't recommend bed rest at any point in their pregnancy. So I don't even know what the point of this comment is. No, giving birth as a human is not automatically an emergency, but there are emergencies that come up in the pregnancy and birthing process. Remember that pregnancy and childbirth is not health neutral. And in fact, this completely ignores all the many people in human history who have passed away from the process of pregnancy and childbirth. So we should actually be very thankful that we live in a time where we have all the medical and surgical means that we have to try to keep our patients safe. And so by saying that the human body knows how to birth is just disrespectful to all the people who have severe morbidity and mortality due to this process. Is the only part that I agree with, and that is that movement in patients is very important in the pregnancy and childbirth process. And it's very important that we as obstetricians make sure we follow the standards of care when it comes to discussing a C-section for things like labor not progressing. When it comes to animals and humans giving birth, sometimes we need a C-section. You know who doesn't feel bad about needing a C-section? The French bulldog. So if you have to have a C-section, know that it's not your fault. And my real question to this chiropractor is that if the human body is so good at what it does, why do we even need a chiropractor to adjust it? I'm just saying.